Hello, my name is Brianne Roan. I'm a nursing student here at Chamberlain, and this is my catheter insertion video. I'll be performing today's catheter insertion on Mrs. Brianne Roan, Mrs. Teddy Roan, sorry. Gonna knock on the door, let myself in. Mrs. Roan, the patient would then acknowledge me to come in. I have in hand my blanket, my sterile environment here. I have my blanket for the patient, something clean to put under them to catch any drainage, and I have my catheter kit. Okay, Mrs. Roan, my name is Brianne. I'm a nursing student here at Chamberlain. I will put these items here on the bedside table in the sterile area. I'm here to do a catheter insertion on you. The physician has ordered me to do a catheter insertion. Is that okay with you? The patient would then give me her consent. Okay, Mrs. Roan, before I get started, I just have a few questions. Just want to make sure you don't have any known allergies or anything. I'm going to be using latex glove. I'll be using iodine to clean the genital area. And just want to make sure everything's okay with you. I want to have your verbal consent. Good. Okay, before I begin, Mrs. Roan, I will start off by performing some hand hygiene. Okay, I'm gonna lower your bedside rails to make you more comfortable. Now that my patient is lowered, I will begin by confirming my patient's name and date of birth with your bracelet. And can you tell me your name and date of birth? Okay, the patient has told me that their name is Teddy Roan, 12/26/1996. That matches my documents, which the physician handed to me to do on the patient today, matches her bracelet, and she gave me verbal confirmation that this is her name and date of birth. Now that you're in the supine position, I will lay you back in the supine position. Okay, I'm gonna start by placing this blanket over you, this covering. I'm gonna fold back your bed linens. This would also be included in the gown if we were in the hospital setting. I will fold back your bed linens. I'll place this under you using the sterile technique. Place this under you. Gotcha. So now I'm gonna lay you back flat in the supine position. Push your knees up towards your chest. Legs spread open wide so I can get a look at your genitalia. I'll be looking at your genitals, assessing your labia for any redness, swelling, or irritation, any wounds or rashes before I get started. So this position will just help me look at that better. I will fold back your gown and your blanket up so I can see the area a little bit better. Okay, I'll perform some more hand hygiene. Okay. And now that I have my catheter on my bedside table, I will then use the sterile technique, using only my fingertips to open up the catheter, bring it out. I have used this catheter before, so everything is not fully intact. I have my trash bag that I'll be using to put all of my equipment in as I am done with it. So, and then I will then put all of that trash into the big biohazard or trash bin, whichever is applicable. I can see my patient's genitalia well. I can assess it and see that there's no rashes, any wounds, any lesions, any swelling. Okay. Everything seems to be done. I looked at the genitals of my sister's in the supine position. The blanket is pushed back. The towel is underneath to catch any drainage. Now that I have that done, I perform more hand hygiene. I can open up my catheter kit. Now that it's on the sterile environment on the bedside table. Sorry, you can't see me and Mrs. Teddy in this video. I'm gonna try to push it back as long as I can. Okay, I don't want to touch and contaminate any areas, so I won't be touching anything. Just trying to move the computer out the way so you're able to see the video. I will then start by opening it up, the first tab away from me, side to side, and then towards me. In my catheter kit, we seem to, as if we have a drape already, which I can put underneath the patient, shiny side down to catch any drainage above the towel. I wasn't aware that we had something other than the towel in the kit. Okay, gonna perform more hand hygiene now before I begin touching everything. Okay, I'm just gonna open up once I have my kit open, gonna take this, open it up using sterile technique, shiny side down, and gently place it under my patient. Are you experiencing, are you comfortable? Gotcha. Just want to keep your legs open wide so I can still see the exposed genitalia. Okay. I'm gonna use my opening to see to close off the genital area. Still using the sterile techniques. Not touching a lot of things. And then we'll go in my kit and find my Don's gloves. Using my 9 dominant hand, I will open up this glove kit in a sterile environment on the bedside table, trying not to cross-contaminate anything. I'm gonna put on my gloves first with my starting with my 9 dominant hand. Okay, Mrs. Ron, I'm gonna take a second to get my area set up over here. Do you have any questions or concerns with me and just want to double check no known allergies of any latex, any iodine, or anything for the lubricant I'll be using today? Gotcha. Open up my kit. All this will be in the sterile environment, trying not to touch too much. At the bottom, we have my catheter kit. I have my iodine, which I will use and pour all over the cotton balls. I'll be using this to cleanse the general perineal area. Get one swoop down. I don't want to move too far within my 1-inch border of my sterile field. Okay, Mrs. Ron, I'm gonna open up your labia, look at your genitalia. I'm gonna use these cotton balls with 1 swoop of iodine to cleanse the area. Okay, 1 swoop down, put it into the bag. And if I had more room in a table, the bag would also be on the patient's bedside for easier transportation and not moving too far out of the environment. I'm using another one to get inside the labia on either side. One swoop. So now that I've used that, I will put my tongs into the bag as well. We have in here my urinary catheter. I've used this kit before, so the plastic wrapping is not on the catheter, but if it was, I would take the plastic wrapping off. I would place the catheter in between the legs of the patient. Gotcha. My patient will have the catheter placed on the bedside. I have will be my saline solution or my balloon kit to fill the catheter, keep it in place. I'll place this over here and pretend that it's inside of the patient's leg if we were on a hospital bed setting. I'll also use this as my lubricant to fill the tray up. I will use that to wet the tip of the catheter. Okay, and before we begin, Mrs. Rowan, you may feel a little pressure within the labia, within the area. I just want you to bear down for me when I'm inserting the catheter. It'll be over quickly. If you become too uncomfortable, just let me know. And I'll do my best to try to accommodate you. Okay, I would screw this in to this area. If we're in the hospital setting and this actually fit, this will go into here to insert the balloon catheter. I would then take the tip of my catheter after the plastic has been removed and put it into the tray using some lubricant. Okay, like I said, Miss Rowan, you may experience some pressure, but nothing too bad. If it gets too uncomfortable, just let me know. I'm using my 9 dominant hand to open up the area so I can expose the urethra. I will be inserting the thing now. Can you bear down for me? Good. Like I said, you may experience a little pressure. I will keep going until I see some urination within the tube. If we're in a hospital setting, I would actually see the urination going into the catheter. I would then have my balloon catheter I would push it all the way down, keeping my hand on the plunger, syringe, keeping it down. Dispose of my balloon catheter. The balloon has been inserted. I inserted the catheter about 1 to 2 inches deeper after I saw the urine to make sure that it was in place. I'm going to give it a slight tug to make sure it's in place. Everything seems to be intact at the second. We then will have to put the catheter bag along the bedside rail. Keep it down so the urine can flow without any kinks into the urinary bag. We have the clamp. If we're in the hospital setting, we'll attach that to the patient's leg. Use Velcro to secure it, or any tape or anything. This will be secured to the patient's leg. Mrs. Teddy will now have the catheter insertion properly. Okay, Mrs. Teddy, your catheter is inserted. Do you have any questions for me? Good. Now we'll remove the drape from the area. The catheter will still be in place. Put this into the trash bag. I would then take off my gloves. Now that I've taken off my gloves, I'll perform hand hygiene again. I would then raise back up the bedside rails of my patient, fold down the blanket, which will also be her gown in this situation. I would then make sure that my patient has a call lock so she can notify me if there's any concerns. I would disregard of all of my trash into the necessary bin. Still being careful to use the aseptic technique so I'm not cross-contaminating anything. This will go into the trash bin. I would also remove this from under the patient. Place it in the trash bin. Once we come back for the removal, Mrs. Roan, we'll do this whole process again. I'll reintroduce myself, perform hand hygiene, and don clean gloves. I'll give you some time to rest and reset myself for the catheter removal. Do you have any concerns? Well, thank you for letting me do this. If you have any questions, just let me know.